H3N2 is a type of influenza A virus. So it is not a COVID virus, it is an influenza virus. And influenza viruses can be of A, B and C type, out of which A is the commonest, and H3N2 is a type of influenza A virus. Because the virus has a central core, which is RNA in influenza, and there is an outer protein cover which is called the envelope, and the envelope has different proteins. So in influenza there are two types of proteins, which is H type, which is heme agglutinin, and N type, which is short form of neuraminidase. There are 18 variants of H and 11 variants of N, and these different variants can combine in different forms. So one such form is H3N2. H3N2 is not a variant of COVID. We have gone through COVID pandemic for last 3 years, so everybody is worried that is it another type of COVID variant. H3N2 is a contagious infection. It spreads through respiratory droplets. That means if somebody is sitting close by and the patient who's infected and is taking a deep breath, coughing, sneezing, it can spread. It can also spread through contaminated surfaces or through contaminated hand also. H3N2 being an influenza virus, and influenza virus A has been infecting human beings for centuries. If you remember, the last pandemic which happened was because of the Spanish flu, which was an influenza virus. Then we had a swine flu infection, that was also an influenza infection. So H3N2 is also a type of influenza infection. Because we keep getting influenza infections, so we do have a natural immunity, and we have some vaccine acquired immunity also, because some people take yearly influenza vaccine. So this virus does not have a tendency to become a pandemic, but we have to be careful because viruses are very smart, they're naughty, they change their structure. So we have to be careful, and a respiratory coughing etiquette should always be on the mark. So influenza infections can cause cough, cold, fever, body ache, malaise, and there can be sometimes respiratory distress in immune compromised people. Otherwise it is an upper respiratory tract infection, rarely affects the lungs, but whenever it affects lungs in extremes of age and immune compromised individual, the child may become very dull, lethargic and refuse taking feed, and in elderly people there may be fall in oxygen saturation or bluish discoloration and person being very dull. If anybody sees these symptoms, should immediately contact the hospital for immediate care. All respiratory viruses almost cause similar symptoms. So it is very difficult to tell whether it is influenza, COVID or any other respiratory virus based only on symptoms. RT-PCR is the final test to tell whether which type of virus it is, and it is done through throat and nose swab. Now after COVID-19, we are all aware of RT-PCR testing. So RT-PCR test can be done easily, but just because to reduce the burden on the labs, the government has made certain guidelines. So all those people who require hospitalization need to be tested, because in those cases you may need some special treatment. Otherwise the treatment is only symptomatic. So for clinical use, people who have mild disease, they need not to be tested. Influenza infection can affect anybody, irrespective of age and gender, but people who are well vaccinated, there are less chances. It can be more serious in extremes of age, like children less than 2 years, people more than 65 years of age, and people with low immune system because of medication like steroids or immune suppressants, people with comorbidities like uncontrolled diabetes, heart problem, lung problem, kidney problem, people on chemotherapies and radiotherapy. Influenza is a respiratory infection, so all infections which spread through respiratory route can be prevented by using proper mask, also with hand hygiene, full vaccination, maintaining social distance whenever possible, and also infected people should stay at home so that the chances of spread in the community is minimum. There is an effective and readily available influenza vaccine. This vaccine is usually tetravalent, that means it has 4 types of virus in it. 2 are influenza A and 2 are influenza B. In influenza A, it covers H1N1 as well as H3N2. Ideally, everybody should take it, and every year it should be taken. A new strain is available or new vaccine is available in September and October. But you're never too late to get vaccinated. You can take it if you have missed the September-October time, because we fall in an area which typically doesn't behave like the northern hemispheres. So we keep seeing influenza spikes with every season change. So one you have in winters, then again in April, then with monsoon also we have a influenza outbreak. People who are extremes of age must take it. People with comorbidities should also take it. Rather, people who have weak immune system should take it twice a year. So one in September, October, and again in April, so that it provides year-long immunity. Sometimes in children also we give 2 vaccines which are 1 week apart. Similarly, people who are on immune suppressants, they are also given 2 doses of influenza vaccine. So some people can continue to experience symptoms 4 to 6 weeks after recovery, which is because of the hypersensitivity of the airway. So people can continue to have a dry hacking cough, but this will also get better with symptomatic treatment. It is very rare for influenza infections to leave a permanent scar into the lungs. May happen people whose lungs get affected. Otherwise, influenza is an upper respiratory tract infection, but very rarely in immune compromised people it can cause pneumonia, and some changes may be residual.